Hi, my name is Dr. Niaz Reza. I am a medical practitioner and cosmetic medicine physician. If you are into skincare, exosomes are the buzzwords you're going to hear this year. Today, we're going to deep dive into exosomes, what they are, how do they work, what are the science and evidence says, and what you should consider before signing up for a treatment. So exosomes are tiny nano-sized particles released by cells, and they have a lipid bilayer and they come as a parcel. They generally carry lipids, proteins, messenger RNA, microRNA, cytokines, growth factors, and so on. They carry information and they deliver information from one cell to the other, working as a cellular messenger system. For example, cells in the dermis or in the hair follicle, they release exosomes, and that exosome can change the behavior of the neighboring cells or even cells that are distant. A recent review described them as a extracellular vesicle with lipid bilayer containing various ingredients such as proteins, RNA, microRNA, messenger RNA, and metabolites. In the context of hair and skin, their appeal lies in their ability to regenerate, repair, and signal rather than applying an active topical ingredient. Matrix remodeling and fibroblast activation. So when exosomes that are derived from mesenchymal stem cells reach the dermal fibroblasts, they increase the production of collagen type 1, collagen type 2, and they also increase the production of elastin. On the other hand, they decrease the production of MMP1 or MMP2, which stands for matrix metalloproteinase, something that breaks down the collagen and other support structures of the skin. Signaling pathways. Exosome influences key intracellular pathways. The PI3K AKT pathway, which is a very important pathway, also known as phosphoinositide 3 kinase or protein kinase B pathway. It's a very important intracellular pathway which influences cell survival, cell proliferation, and metabolism. The WNT beta catenin pathway or wingless beta catenin pathway is also extremely important. This pathway plays important role in stem cell activation and stem cell remodeling, especially in hair follicles for hair regeneration applications. The NFKB or nuclear factor kappa light chain enhancer of activated B cells. It is a central driver of activation of aging process and inflammation. Exosomes can modulate this NFKB, and it reduces inflammation and oxidative stress relevant to the skin. Hair follicle activation. Exosomes can increase the activation of the hair follicle and stem cells. It can also help with angiogenesis, which is new blood vessel formation at the root of the hair. Exosomes can also stimulate the hair papilla, and it can also lengthen the anagen phase of the hair cycle, which is the most important phase where the hair actually grows. So it can extend that anagen phase. In return, it can improve hair regrowth. A recent study done by Rajendran shows application of exosome for hair regeneration shows increased hair density and thickness of the hair. Antioxidant and anti-inflammatory effect. Exosomes can inhibit the inflammatory cytokines. It can reduce the reactive oxygen species, which is also known as free radicals, and it can improve microcirculation. All of this together can create a favorable microenvironment for the skin and hair regeneration and rejuvenation. So, in effect, instead of putting something on the skin, exosome therapy sends clear and specific instructions to the target cells, and it revives the dormant hair follicles, such as in case of a hair loss, or it can rev up the repair mechanism in the skin to rejuvenate. So what can it be used for? In the domain of skin regeneration, rejuvenation, and hair regeneration and restoration, here is how the current science divide. Hair rejuvenation in hair thinning. People with androgenic alopecia who have thinning hair, exosome treatment either with direct injection or microneedling plus exosome has proven to show that the hair actually regenerates, it becomes thicker, and it becomes more dense. A PubMed review titled Exosome for Hair Loss has shown that the hair regeneration with exosome is quite effective. However, large-scale human data is still not available. Skin rejuvenation. For photo-damaged skin, fine lines and wrinkles, and irregular texture and pigmentation, exosome has been used either alone or in conjunction with microneedling or other transepidermal delivery systems such as RF microneedling and fractionated laser. It has shown to improve the tone and texture, pigmentation, and it also shown to improve collagen and elastin production. In a comprehensive dermatology review, it has been revealed that exosomes can cause quite a few things, including scar treatment, hair regeneration, and skin rejuvenation. It is important to stress that exosome can be used with other modalities such as laser and microneedling, and it can also be used as a standalone treatment, but adjunct therapies are more commonly practiced and more popular. Regulations and limitations. No overview is complete without caution. There are no exosomes that are currently approved by the FDA for injections. This regenerative field of exosomes suffers from lack of randomized controlled trials, variable product sources, and inconsistent processing and heterogeneity in results. Safety concerns, impurities, off-target effects, donor cell variability, immune activation, and infection risk. A dermatological review flagged substantial safety concerns such as the potential risk of infection and risk of unwanted inflammatory response, potential risk of malignancy or promotion of malignancy. So realistic expectation, positive signals exist, but it's still emerging science, not miracle cure. Who is this for? In my clinical view, exosome therapy is best positioned as an adjunctive regenerative treatment rather than a first-line standalone treatment. The ideal candidates might include patients already undergoing facial rejuvenation treatments such as laser or microneedling, looking for enhanced recovery or texture improvements, individuals with hair loss or hair thinning who have tried standard treatments such as minoxidil or finasteride and are seeking next-gen regenerative options. However, be aware of the evidence gap in these cases. If you are considering it, ask your provider for product source, quality controls, sterility, documented evidence, and review your baseline and follow-up outcomes. My goal is to bring you cosmetic and regenerative medicine grounded in rigorous science, not the hype. If you found this helpful, subscribe and stay tuned as we push the boundary of what aesthetic medicine can responsibly deliver.